Let's get this straight. There's a measles outbreak ripping through the country, and RFK Jr., that conspiracy theorist and vaccine skeptic, is running public health. Then Doge slashes tens of thousands of HHS jobs. And Kennedy's not just okay with it, he's backing it. Chris Cuomo and Stephen A. Smith came out swinging on News Nation. They challenged Trump's health secretary directly on what many see as reckless, even dangerous leadership at HHS. So what does he have to say for himself?
Check the mic and make sure it sound right, boys.
You can explain to the audience how concerned we should be about measles. But it is an interesting conversation around the vaccine. And there is criticism that comes your way. Now, your messaging on it, you've been telling people to get vaccinated. But there is criticism of you, Bobby, that, oh, now you're saying get vaccinated. You weren't saying that during COVID. That's why people aren't getting vaccinated. And now it's a problem. How do you deal with that issue, and what responsibility do you have in terms of how people feel about getting vaccinated?
We're doing better in managing our measles epidemic in this country than probably any other country in the world that has outbreaks right now. We have about 842 cases, Chris. In Canada, they have about the same number. They have 1/8 of our population. Europe has 10 times that number. Our numbers have plateaued. So you're still seeing added measles cases, but the rate of growth has gone down. Now, there are populations in our country, like the Mennonites in Texas, who are most afflicted, and they have religious objections to the vaccination because the MMR vaccine contains a lot of aborted fetus debris and DNA particles. So they don't want to take it. So we ought to be able to take care of those populations when they get sick. And that's one of the things that CDC has not done. CDC has said the only thing that we have is vaccination. There's all kinds of treatments when people do get sick, and those people should be treated with compassion. I'll say, and we ought to have good treatments for them, and that's what we're developing at CDC right now. Protocols are treating measles.
Hold up. Can I say something? For years, we had well-spoken, well-groomed public health officials in charge. Highly credentialed, smooth on camera, always saying the right things. And now we've got a guy with a speech impediment who half the country thinks is a nutcase, finally saying what nobody else would. Something is seriously wrong with our public health care system. Is that not epically ironic?
I want to say this. We've had 4 measles deaths in this country in 20 years. We have 100,000 autism cases a year. We have 38% of our kids now are diabetic or pre-diabetic. That should be in the headlines. When I was a kid, the average pediatrician saw 1 case of diabetes in a 40 or 50-year career. Today, 1 out of every 3 kids who walks through his office door is diabetic or pre-diabetic. That should be getting the headlines. When I was a kid, 2 million, there were 2 million measles cases a year, and none of them got headlines. And we had 400 deaths. We had deaths about between 1 and 1,200, 1 in 10,000. We have so many kids now who are afflicted by chronic disease, and the media never covers them. They only want to cover measles. And what I've been saying to people is, let's pay attention to other illnesses as well. And the illnesses that are really, really damaging our country, that are existential for our country. We now spend almost $1 trillion a year on diabetes and metabolic disorder. By 2035, we're going to be spending $1 million a year on autism. Autism in 1970 was 1 in 10,000 Americans. Today, it's 1 in 31. In California, it's 1 in every 20 kids, 1 in every 12.5 boys. This is what the media ought to be focusing on, and it's not. And because of that, we don't have the solutions and we don't have the cures.
This is the politics of healthcare. You could hate Trump. You could think RFK Jr. is a reckless choice. But when RFK Jr. joined the ticket, something shifted. Not because people suddenly agreed with all of his views, but because his message hit a nerve. Did you know that according to our own CDC, the United States is the sickest developed nation on earth? The U.S. spends more on healthcare than any country, and yet we have the highest rates of chronic disease, the lowest life expectancy, and the worst health outcomes among developed nations. The people probably can't quote a JAMA study, and they didn't even know who Fauci was before COVID, but they feel it. They see it in their kids, their parents, the mirror. We know our diet is garbage. We know the meds aren't fixing anything, just masking symptoms. Got depression? There's a pill for that. Overweight? There's a pill for that. Your kid doesn't act like the others? Don't worry, there's an SSRI for that. Chronic disease? Come on, that's what health insurance is for. Somehow, healthcare became a system built on managing illness, not restoring health. Here's a conspiracy theory for you. 9 of the last 10 FDA commissioners took jobs with Big Pharma after leaving office. Dr. Scott Gottlieb left the FDA and joined Pfizer's board. Stephen Hahn, Trump's guy, went to a venture capital firm that incubated Moderna. Pfizer? Moderna? The same 2 companies that made the mRNA vaccines. Starting to see a pattern? But what about those Doge cuts?
Mr. Secretary, Stephen A. Smith here. Thank you for coming on the show. HHS reduced your employee status from 82,000 to 62,000 employees, if I remember correctly. Cut about $1.8 billion. But nevertheless, you got a lot of American citizens wondering how on earth are you going to ensure that we're going to become a healthier society with over 20,000 less employees to look over things and purview things to some degree. What do you say to that?
Well, I would say during the Biden administration, my agency grew by 38%, and Americans got sicker. So it's not throwing money at it or hiring people that is solving the problem. We have so much redundancy in our agency. We have 100 communications departments. We have 40 IT departments. We have 40 procurement departments. What we did is we're streamlining the agency and we're recalibrating its trajectory so that people there are narrowly focused on one issue, which is how do we end the chronic disease epidemic? When my uncle was president, 3% of Americans had chronic disease. Today it's 60%. It's costing us $1.6 trillion a year, about 95% of our healthcare budget is going to chronic disease. When my uncle was president, we spent 0 on chronic disease. 74% of our kids cannot qualify for military service. So this is an existential threat to our national security. It's an existential threat to our economy. And we have to narrowly focus on that. And that's what the new HHS is doing.
Look, RFK Jr. might not have all the answers. He might even be wrong on some things. But in less than 100 days in office, he's done something we haven't seen in decades. He's reset the conversation. For years, we were told synthetic dyes and food were safe, that autism had 0 connection to environmental factors, and that ultra-processed food was convenient and nutritious. And vaccines, you weren't even allowed to ask the question. Now finally, we're running real studies. You know, the gold standard studies public health officials demanded of ivermectin and hydroxychloroquine. We're asking hard questions of the people that were supposed to keep us healthy. And now they're being forced to answer them with real science. If that's all RFK Jr. accomplishes, just getting the country to stop, think, and question, that alone might be enough to make the first 100 days of this administration a success. Whoa, Brian, let's not get out over our skis. Still a skeptic of RFK Jr.? Good, because learning to ask the right questions is how we discover truth. And our nation could use a big dose of truth right now. I'm Brian Tuttimore for Faith Check News. Remember, think right to live free.